Good afternoon. Welcome to yet another press conference with the Bucks County Commissioners and our staff. Today with us, we have Larry King from Public Information. He'll be asking the questions. Eric Nagy is with us from our Projects and Policy Director. Dr. David Damsker from our Health Department. Gail Humphrey she's our clerk. We don't have any election questions. And we have another guest today, and that's Tom Jennings. Tom Jennings was the chair of our Transition Committee, which is where we'd like to start today. And we'll pass it down to Commissioner Harvey and then Commissioner DiGirolamo, and then Tom has some words he'd like to say. So when the three of us won our offices in November and knew we were taking over in January, you're always anxious. What should you do? What's your goal going to be? What do we want to accomplish? And so one of the best things that we decided to do was to come up with a transition team made up of people throughout the community, as well as some employees of Bucks County, and ask them to come up with a plan for Bucks County. So Eric is going to put that in front of us, and we have some PowerPoint slides. So this is the final report, which I believe you all have a copy of and access to. Okay, Eric. And the chair of the committee was Tom Jennings, and the co-chairs were Michael Clark of Rudolph Clark, Keon Growney of Curtin and Hefner, Greg McCarthy of McCarthy Law Office, and Eric Nagy, our Director of Policy and Projects. There were also a variety of subcommittees. As you can see, I won't read all the names, but there was Budget and Finance, Communications and Information, Economic Development, Environment and Energy, Health and Human Services, and Government Efficiency. So these committees all met and they put the report together, and I will hand it to Commissioner Harvey. I think you're on mute.
All right. Thank you, Diane. As you can see, one of the first things Commissioner Marseglia and I did when we started forming this committee, working with the executive board that you just saw, that Tom was the chair of, was to decide what areas of county life, county government, what issues going on in the county we wanted volunteers to be focused on. And that's where we came up with these 7 subcommittees. The chairs, Tom Lynch in Budget and Finance, John Lewis, Communications and Information, Steve Ray in Economic Development, Steve Sinicero in Environment and Energy, Kathy Walsh Beveridge in Health and Human Services, and Amy Strauss. They populated their groups. They went out and found people who they knew had expertise in these fields and were willing to volunteer. Everybody on this screen and the previous screen, all the members volunteered their time, and it was really hours upon hours upon hours. Starting really in December, a lot of these specific groups started to meet, and their reports came back to us between sort of April and May. The final reports came in, and in all cases, the reports were very kind of forward thinking and really deep in terms of analysis of what was going on in the county and giving us recommendations. And I said this yesterday in the meeting, in our commissioners meeting, that we didn't put any restrictions on any of these people or any of these subcommittees. We made it clear to them that they could recommend anything they felt was necessary. They could bring up any point they wanted to bring up. It doesn't necessarily mean that, and we didn't really see any of these reports until they came in. And so, we wanted just a sort of an unvarnished look and opinions from people that know the field and know the county, and in terms of where we should be looking and ideas for change. It doesn't necessarily mean that we're going to be enacting all the changes they recommended. Some of the changes have actually already been begun in terms of implementation and planning. Others are going to take a while, because they're much bigger. In some cases, there may be some recommendations that we just decide for a variety of reasons, that we may not choose to undertake. But in the grand scheme of things, it's really a tremendous amount of effort went into this and analysis. This is the kind of thing, these studies, you're looking at 7 different studies. The amount of money that any organization would have to spend to bring people with this expertise together and have them spend months of time reviewing and coming up with a plan is easily in the tens and tens of thousands of dollars for each one of these. So it's a tremendous savings and service they provided for the county. Eric? We just kind of highlighted some of the major points for each of the departments, each of the 8 subcommittees. As Commissioner Marseglia said, the full report, which has sort of been compiled into one document, has been, I think, shared with you, I think, through Larry King. It is also available for public view on our website, so anybody can look at it in its entirety. As you can see here, some of the things that we've been asking, we're going to be looking to do. Reducing budgets by 2%. This is a budget issue and finance issue, and in some cases for departments and agencies that aren't able to necessarily cut, what we're asking them to do is to find ways to maybe squeeze that extra 2% of efficiency out of the money they have, and taking actions within their own organization and operations. Trying to find ways to maximize any revenue streams in some of the agencies that do generate funds in some way, and also looking for grant opportunities. The county has had a budget deficit. This is just factual information. 3 of the past 4 years, 7 of the past 10, the county has spent more money than it has brought in. This is just the basic mathematics of it. And what that's led to, and Eric can move the slide, is it's led to a fund balance decrease of 53% over the past 10 years. Recently, I know there was some news stories that went out about the fact that our bond rating was kept by Moody's and S&P, but each of them had a negative outlook. And while we kept the AAA, both of those organizations indicated that the fact that this fund balance has dropped so much is a reason for them to have a negative outlook on any, on future bond ratings for the county. So that's something we don't want to have a negative outlook by anybody financially. So we're trying to figure out ways to turn that around and make it positive. Eric? In terms of IT, the website design, really needs to improve. It hasn't changed in I think over a decade in general. It needs to be totally revamped. There has to be an inventory of software, which really hasn't been done throughout the entire county. All the agencies using different software. Some of them are outdated. They're not supported anymore by the vendors who made them, who we bought them from. We have outdated technology that's being used, and so all of that needs to be examined in a deep level. Eric? In terms of economic development, there are different agencies in the county government that, and a little bit outside the county government, that do economic development at some level. There isn't necessarily a synchronous approach to economic development. That was the biggest takeaway from the people on that committee, that it needs to be streamlined and consolidated, and we should be looking for ways to foster entrepreneurship, especially with in the gig economy and sort of new age kind of economic activities and businesses that we can really kind of, we think, help prosper here in Bucks. Better. With energy and environment, there are a lot of recommendations moving toward as many paperless operations as we can in terms of documentation in this county, initiating energy saving practices, simple things like using LED lights as much as possible, looking into alternative energy, green energy in some of our buildings and properties, utilizing more locally grown foods. That's something we've already begun to explore with farmers here in Bucks County. How we as the county can be purchasing more food for things like the corrections facilities as well as Deshawnee Manor. Can we be helping our own agricultural community by purchasing more food directly from them, which would also, of course, cut down on how food's being transported and shipped, and how far we're getting it, and taking a look at current methods and policies with recycling here in the county and how we can improve. Eric? Our facilities and parks, people on this committee went to every single park we have. They took a look at every one. They found in general the parks were in good shape, but they certainly saw a need for increased signage. There were a few parks that do need some attention. Peace Valley was one that was highlighted as one that is a very, very popular park, very well used, but it certainly needs more attention than it's been getting. And just in general, making people more aware of the fact that the park system, all the different options we have and different places we have throughout the county for people that want to explore the park system here in Bucks. Government efficiency also focused on how do we take the existing operations here in the county and make them better. In some cases, we have duplication of tasks, and there's not a lot of overlap. There's not a lot of communication between different agencies that could be communicating more. How do we better serve the residents and businesses? And a lot of that overlapped, as you can imagine. There's a lot of overlap here with things for IT. You know, so many people, and it's been highlighted in the past few months, so many people are doing things over the internet and through our website. And how can we make that more efficient through all our departments and agencies? And investing in real professional development for county staff, so to help them, you know, maximize their skills, which of course is going to help them maximize what we can do for the residents. Derek? The largest part of this, which makes sense because it's the largest thing the county does, is Health and Human Services. This report itself, in its original form, stretched to about 85 pages. And it was incredibly detailed, looking at all aspects, you know, things like homelessness, you know, issues of consolidating some of the, or some functions, but also more communication between agencies and departments so that they can better serve residents. It took a look at, you know, in some cases, workforce development, which overlapped with the economic development, and made a lot of, you know, really tremendous number of recommendations about ways to move forward in the county in terms of what we do. About 2/3 of the budget of the county is social services. And so that fits in here when it comes to housing and all the other things that the county does. So, Eric? All right. So just as a kind of wrap this up, and I'll let Tom comment on his role and his view overall, sort of from his seat. What we have done is provided this information to all the department heads, division leaders, agency leaders here in the county. The row officers all have this. In addition, they were given sort of a 2-page list of goals, taken, you know, kind of crunched down and consolidated from the big report, things that we would like each of them to focus on, and ask them to report back to the commissioners by the end of this month about how they can implement some of these goals and directives moving forward. And from there, we'll, you know, sort of use this as a strategic planning model that we can bring in all these ideas and we can, as a county, start moving forward. So, and Tom, I don't know if you, I mean, we can't say enough about the work that Tom Jennings did in helping kind of shepherd a lot of this, helping to recruit the chairs, helping to organize meetings, helping to sort of facilitate this really from mid-November up until now. That's been something, a service that he's provided to the county, and again, on a volunteer basis. So we really can't say enough about that. I want to thank Tom and let him say a few words.
Thank you, Commissioner. I would like first to emphasize to the public, to the credit of the commissioners, we undertook this effort. The law did not require it. There was no need of even a policy position to do this, but you had the foresight for us to put something together, and so we proceeded. As you've noted, I think the first critical steps for us were identifying the areas of inquiry, and we had that done before the end of November. And we started to recruit just excellent subcommittee chairs. All 7 of them performed so generously with great insight, and they in turn recruited the members for their committees, which were an assemblage of outstanding talent, people well known in the community and in the Commonwealth for contributing to public service. So this was a massive volunteer effort because people believed that we should have an efficient government and wanted to contribute to those who serve us in office with some good ideas and some practical suggestions. That was a key element of it. As we told our subcommittees, focus on whatever you see is important in your area. We couldn't do everything, and we intentionally wanted to keep this to a fairly short window of time. March 30th had been a target date, a soft date, and we had a lot of material done by then with the reports that followed in April and May. pretty much on schedule. COVID-19 notwithstanding, we got it pretty much done when we thought we would get it done. And as I say, offered with some items that the commissioners could consider for short term, some things that might take a little bit longer, some things even more aspirational. But we tried to do that and be pretty practical about it. Always sensitive to the fact that, time and money are often in short supply. So we were tried to be realistic about it. Some other areas of county government which were not included here, I think some of the individual reports identify this would be something to look at a later date with other people, whether volunteers or other professionals. So we tried to cover the waterfront in a short period of time. And again, I think it was the wisdom of the commissioners that saw this as something that would be good to do, important for Bucks County to have it done, and to try to move forward to whatever degree makes sense over time. And just as we were building on the good work of those who preceded us, you'll build on the good work that we have left you with for posterity. And once more, the volunteers, thank you for making my life as a citizen better. You have enriched me for that. And for those who serve us in public office, you've done a great job. And lastly, I want to thank Eric, who was the editor of the 7 reports. Good job, Eric. Thank you for that. Commissioners?
Thank you. And thank you once again, Tom. You are the unsung hero of all of this. And I rely on you all the time for advice. And this was just the best thing that you could have ever done for us. Thank you so much.
You're welcome.
Larry, do we have questions with regard to this transition report? Anything out there on that issue?
Commissioner, we have a couple of transition team report questions from Chris Ullery of the Intelligencer. Chris mentioned that you said yesterday in approving the transition report that it was like a report card that the county can keep referring back to. Is this report similar to a comprehensive plan that municipalities typically follow to guide policy for several years or decades?
I think I see it more as a strategic plan, less as a comprehensive plan. There were certain parts of the county that we, didn't necessarily look at, the 911 center, for as an example. But this is a strategic way that we want to go about dealing with those areas. There's so much that can be done in county government, but you really need to get the priorities. And so it really helped to find out what experts talking to people who work for the county and people who work in the county would find. So I would say it's like that. And I think that we'll pull it out like a report card and say, look at each issue and see how we're doing. And so can the public. You'll be able to pull up that transition report and grade us on how much progress we've made. Yeah. Gene or Bob, any thought on that?
Go, Gene.
Just a quick comment, and and just for full disclosure, I mean, my involvement in putting this report together was very limited. Although I very much appreciate Tom's work and all the volunteers. I mean, I think they really did an incredible job. And just to remind everybody, this was put together by volunteers, and did not cost the county a penny to put together. Certainly the issues in the report that deal with fiscal responsibility and government accountability are really, really good issues and something we should be looking at, and something that's really important to all of us. And as someone who served up in Harrisburg, as chairman of the Human Services Committee, the report of how we can better manage our health and human services in the county and our housing. I think there were some, great recommendations, and I'm looking forward to, there's a lot there to digest, and I'm looking forward to moving forward to seeing what things in that report that we can implement. And I'm looking forward to hearing back from the department and the department heads on what they actually think about the report. So I just, again, want to thank all the volunteers who helped put this together.
I think just to one thing that Commissioner Marsegley said, which is important to remember, I don't remember if I said it or not, is that all of these subcommittees This wasn't something where they're sort of standing outside the glass house looking inside and saying, well, we see problems. They did actually meet with county employees in these fields and ask them questions and try to get their input. And so we wanted to do this with the involvement of people who have been working for the county in some cases for decades in the fields that they're in, and to hear what their thoughts were. And that's always a really and critical aspect to doing this. You don't, it's easy to kind of stand outside and point and say, well, I see a problem over there. But if you don't necessarily know what's going on inside, you have to find it out by talking to people who are actually doing it. So that's an important part of this too.
Thank you. Larry, another one on that?
Yes, Chris also asks in regard to the budget and finance section, under immediate actions, there is a recommendation to evaluate major non-core assets for potential sale, and the old Neshaminy Manor property is given as an example. Are there any other assets that might also qualify as major non-core assets at this time? And is there an example of a core asset that wouldn't be considered for valuation?
I don't think we're going to have the courthouse evaluated. So there's a core one we're not going to do. And our nursing home is, we're all very proud of our nursing home. It's rated very high in the state. So we are definitely not evaluating that. I think that, as was said, the primary thing we need to look at is the old Neshaminy Manor, which is in not great shape. We do have, the health department we might want to look at. At least it needs some work on it, if nothing else. We also have houses out there. We have a number of homes that we own in different parks, and I think we need to take a look and see how that works and whether that's a good idea and a good fit for the county or not. Anyone else on that? Okay, go ahead, Larry.
Okay, I don't have anything else on the transition team report. Would you like me to move into some other questions on other topics?
Sure.
Okay, this will be for Gail. I have an election question from Jim Melwert of KYW. And Jim says, Governor Wolf has signed legislation requiring the Department of State to put out a report on the primary election. In his press release announcing the signing, the governor says the Department of State supports legislative change to allow counties to start counting their ballots earlier. Do you have thoughts on that? And what else do you think should be done?
Yes. Can you hear me? Okay. Yes, we would absolutely 100% support that legislation here in Bucks County. We received a lot of mail-in and absentee ballots, a lot more than we expected we would. And giving us the opportunity to count them as soon as possible is something that we're really hoping that the legislature will address as soon as possible.
Anybody else? Okay. Go ahead, Larry, next question.
Okay. Some questions for Dr. Damsker, who's been waiting patiently. How will bus drivers be required to wear face masks that might fog up glasses and prevent them from addressing children who may be acting up on the bus? Will that not be a safety issue while driving? And she's referring to some of the school reopening recommendations that were made to our school districts earlier this week.
Yeah, just first I'd like to say I'm thrilled that I'm not the first person to go. That there's other issues going on besides coronavirus, so that's nice to be third for a change. But to the question about the bus drivers, we are recommending that the bus drivers wear either masks or face shields while they're transporting the children. The face shields should work pretty well, and those do not fog up as well when you're wearing glasses. There are anti-fogger sprays you can use. If you are wearing a mask, there's some things you can do, silly little things where you can put soap and water on your glasses and dry them off, and then you put your mask on, and that film will keep the mask or keep the glasses from fogging up for a while. You have to keep doing that sort of multiple times a day, but there are little things you can do. Certainly, but if people don't want to wear a mask, face shields themselves are easier to wear for extended periods of time for certain people, and that would allow them to have also, if they're concerned about the visual, the field of vision while you're driving, those work as well. But we know that kids are going to act up regardless of whether or not coronavirus is around, or since I was a kid, people have been behaving badly on buses, so that's nothing new. But I think that the guidelines we put in place should allow for drivers to be either wear a mask or a face shield, and shouldn't cause too much of an issue.
Okay. That question, by the way, is from Peg Kwan of the Bucks County Courier-Times, as are the next couple. Will schools need to allow some students to stay at home so that desks can be set 3 feet apart in classrooms that normally have more than 25 students in them?
Well, we know for sure that if they use 6 feet, they will have to keep many kids at home. We're hoping with 3 feet at a minimum. Now, again, it can be 3, 4, 5 feet, but the 3-foot minimum we put in place under the WHO guidelines, we know that most droplets do fall within 3 feet. And there's more studies coming out showing that every day. And of course, 6 feet's a little better, 9 feet's a little better than that. But we feel that with 3 feet, if the classrooms move the seating around and structure it in a way where you have possibly rows of seats staggered, that 3 feet should be able to be met and still get most of the kids in the classroom that normally are there. We are asking them to try to avoid, at least for now, face-to-face seating in the little groups, the little islands of seats that some of the younger children do. And at least for right now, to try to move them away from that and avoid the face-to-face seating.
Okay, and finally from Peg, will schools have test kits for the coronavirus, and will school nurses receive any extra training or PPE?
Yeah, we're absolutely going to be meeting with the school nurses. I'm going to make sure I meet with all the school nurses, the directors of pupil services, to go over these guidelines and give some pointers and tips on how to implement a lot of what we said. We will not be having test kits in the schools. We don't do testing for very few things. We don't have pertussis test kits. We don't have rapid flu tests. We don't do that. What the nurses will do is make sure that the student is masked, brought down to the nurses station if they get sick, put them in a room that's well ventilated, that can be they're kept isolated from everybody else, get them home. Then we'll get the student tested, either at the doctor's office or at a facility, at a hospital, wherever the easiest place to get a test is. But no, we won't be offering the actual coronavirus testing in our schools anytime soon, for sure.
Okay, a question from Todd Shepard of the Delaware Valley Journal. And he said that last week, Dr. Damsker said the county had not yet seen any noteworthy kind of spike in cases from the various marches and protests in the area. Is that still the case? And if not, what additional details can you provide?
No, that is still the case. We have not had anyone who went to a protest and then came home sick from that protest. We are asking people that question in our contact tracing. Of course, not everyone may tell us the truth all the time, and we can't avoid that. But we don't believe that we've seen that we know of any cases directly related to exposure from these protests.
Okay, a few questions from Tom Sofield of Levittown Now. Business owners and residents have reported that many people are declining to wear face coverings when in close, even sustained contact with people in businesses and public spaces. While there are medical conditions that stop some people from wearing masks, medical experts have stated that wearing masks can reduce transmission of COVID-19. Can you explain your opinion on mask wearing and possibly even some best practices?
Yeah, I would say for masking, the most important thing is if you can't social distance from someone else in an appropriate fashion, then masking is a good thing to do. It's much more important inside even than outside. But the idea is with the businesses, if most people wear masks or if many people wear masks, that's really important, right? It's about harm reduction. Some people do have medical conditions. Some people don't and say that they do. But overall, most people are following the guidelines. We are looking at things like in restaurants when we move to more waitress-provided services or waiter-provided services. We want the waiters and waitresses to be wearing masks or face shields. And I mentioned earlier, face shields can be very effective while they're serving the public at restaurants, because the people eating obviously aren't going to be wearing masks, and they're sort of at the mercy of the people serving them. So we expect face shields and face masks to be in things like waiters and waitresses. When hair salons open up, we expect hair salon people who cut your hair, people who do things like that, personal care, to be wearing masks or face shields. And in reality, we want people that are sick to stay home. And again, it's a sort of a pie in the sky idea, because we know some people aren't going to do it. But I think overall people have listened to that message. And this goes back to our school guidelines as well. We expect people not to send their children to school. We expect people not to go to work when they're sick. And that itself sort of allows, if certain people don't wear masks for whatever reason, whether it's medical, whether it's personal choice, that it will allow the spread not to happen. And again, we're also at a low prevalence state right now. We have our lowest numbers of cases today than we've had for months. So that means at the same time, we can't just walk around saying everything's totally normal again. We don't want that. We're putting out new guidelines for instance, at restaurants. I mentioned the masking. I'm concerned personally. You have bars, people that are drinking, that are crowded close together, that maybe aren't paying attention to social distancing. I believe strongly that we should make sure we follow the state guidelines in that particular thing, keeping, separating groups in bars, no standing at bars, separating people, because again, those are situations where you're not going to be masked. And if someone is sick, at least we have the social distancing going on. So overall, I think a lot of people are complying. Businesses have the ability to say, you can't come in my establishment if you're not masked. But there are people, like you said in the question, there are people that can't wear them, for whatever reason. And if you put everything together, people do the best they can, wear the masks in situations, especially where they can't social distance, that'll make a difference, especially if people aren't walking around sick. And all those things come into play. It's going to be a challenge once we move to green next Friday, and I'm confident we will. All the businesses will be open at that point. And we want to still see masks being worn, especially in situations where you can't social distance. That's the most important thing.
Okay. Also from Tom Sofield, how is the county preparing for a potential second wave of infections over the coming months?
I think what's really important is that we continue to not let our guard down at the health department, right? I mean, we've been open every day, making every phone call. We've contacted every person all along. And we're hoping that given the things that the guidelines that we're following, even in the green zone, will keep us in the situation that we're in now. We have probably 10 to 15 cases every single day. And I think I mentioned this multiple times. We don't think we're going to go much lower than that. We expect to have that many cases every day going forward, months, possibly, for longer than that, depending on if there's ever a vaccine or if there's ever a really good treatment. But even a good treatment won't prevent the cases. So, we hope that there won't be a second wave. I think we have a lot of things in place and that most people are following. It kind of goes back to my last question, that we don't want to go back to totally normal, where people are walking around sick, no masking, doing things where they're just not paying any attention to the people around them. And I think we're in a sort of a situation now where people are paying attention to that, even if most people are paying attention to that. And we have a few outbreaks here and there. We will jump on those outbreaks right away. We'll do the contact tracing. We'll get those people tested. We'll get people isolated and quarantined. And that's not magic. That's just good old-fashioned public health. And if we can do that and isolate the outbreaks, because we're going to have some outbreaks, we're going to have some cases. If we keep doing that, I feel like we can avoid a large second wave. We may not see that at all. And there's no evidence to say that there will be one. This is just people's best guesses.
Okay, and also, speaking of the daily numbers, the county recently began noting delayed cases. Is this something new, or is the county just starting to report them? And how do reporting delays happen?
All right, well, yeah, there's been situations throughout where we've had a case that was a couple of weeks old. And the reason why we didn't make a big deal about it, when we had 160 cases, is because if we go from 160 to 156, it didn't really have any public health significance. But now that we're down to 5 cases, 10 cases, 15 cases a day, if you have 5 or 6 that come in delayed and they're not infectious anymore, to me that does make a difference, and people want to know that not every case we got today was a new case where someone's infectious. The 2 major ways that happens are, first, we have people that are often tested out of the area. So someone might get tested who's a Bucks County resident. They may get tested in New Jersey. They may get tested in Philly. They may get tested somewhere far away. They may get tested in Pittsburgh. And so sometimes it takes a long time for that case to sort of make it down through all the administrative bureaucracy to figure out where that case actually lives. Sometimes it gets lost. Sometimes the county where it was reported doesn't do contact tracing, didn't follow up with the case, and didn't even look to see where they lived. There's a lot of reasons why that case could be delayed back to us. And the second thing is, we have a lot of new laboratories that have been open for other things, but just kind of started doing COVID testing. And there's a requirement that they submit all results to the state. It's called the NED system. It's a state computer lab, computer system that we have access to that gives us data. And some of the labs, they did tests. They may have reported the result to the patient or the doctor, but never put it into that NED system. So sometimes weeks go by and just a bunch appear from April, and that because that laboratory just reported it now, that long ago. So by the time we talk to the people, they've been healthy, they've been fine, and there's no public health significance at this point. We don't even contact trace those people, because if they got it, during early May, a month and a half ago, there's very little we can do at that point. So those are the two major reasons why we have delayed reports. And again, now it makes a difference that we're down to a handful of cases every day. I want people to know that if we have 10 cases and 5 of them are delayed report, that we really are saying we have 5 new cases that are in the community.
Okay, just to shift gears and move away from coronavirus for a second, this is probably a question for Commissioner Harvey. Where does the small business grant program stand? I think you have some news about that.
I do. Yeah, after a lot of work by the staff here, Jeff Fields and Deanna Giorno, especially, in the company we hired to do the analytical research of all the applications, there are 465 businesses that have qualified for the first round of funding. They'll be getting a maximum of $25,000. They will be notified in the coming days. We really just kind of solidified that list late on Tuesday. There's some final review that's going on today. We hope to post the names of those businesses sometime today or tomorrow on the website, so people can look to see if they're on there. We will be reaching out to them to let them know about their the grant and getting some paperwork from them, and then we'll be able to sort of cut checks and send those out. There were about 500 other companies or so, 450 other companies who were still considering for future rounds. So if you did submit and your name's not on the list, rest assured we are still looking for a second round of funding. We're going to contact those businesses again, ask them to provide some updated financials, and look at them for possibly for a second round at some point in July. Companies that finished near the top for a variety of reasons. This was all really analytics and statistics, had to do with the amount of decline in sales they've had from over last year compared to this year, the amount of cash on hand they have, how much other aid they had. In some cases, we had businesses that had already received hundreds of thousands of dollars in other financial aid, so they would not have scored very high in the sense of the analytics. How many employees businesses had would also have weighed kind of heavily in terms of whether or not they would have scored high or low. But we will be reaching out to everybody again. And so those 465 businesses, we're going to be sending that money out to them sometime in the next couple of weeks. It's going to be about a little under $11 million that we'll be sending out. I think it's about $10,800,000 roughly that's going to be going out to those 465 businesses.
A few questions from Aaron McCarthy of the Philadelphia Inquirer. Has the county received any new updates or indications from the governor's office or other state officials this week regarding whether Bucks County will move to green next Friday?
We have heard nothing, and I'm sort of thinking that I'm not going to answer any phones or emails just so that we don't have to worry about it. But we haven't heard anything. We have every reason to believe it will be June 26th. Bob, Jean, Doc, anything?
A lot of rumors going around that that Bucks County is going to be included tomorrow and going to green on the 26th of June. So we're very hopeful that will happen, because we absolutely, I think all of us here in county government believe that because of our good work that we're ready. So we're just going to be waiting for the governor's announcement like everybody else tomorrow. Mm-hmm. Very hopeful.
Bob or Dr. Damsker? Okay.
I will just say, from a public health perspective, we better go.
That's right. Yay. Okay, go ahead, Larry.
Following up on that, while you have said you believe Bucks County is ready to move to green, do you have any concerns about outbreaks occurring after reopening, as has happened in some other areas?
Go ahead.
I was going to say that I'm not worried because of you. So you go ahead and take that.
No, I appreciate that. I know that the county is ready. I know that the vast majority of people are going to do the right thing. I have no doubt that we may have a small bump, but remember, yellow, most of the businesses are already open. So 98% of businesses are currently open in Bucks County, and you're adding a few more, like some salons, some gyms. And I can tell you that the salons and gyms, they have some really strong, I've reviewed some of them myself. They have some real strong sanitary guidance going on. I think they're being very careful with their own customers because they feel extra pressure. So I don't think there'll be a big outbreak from those facilities, especially given that we know that if they're wearing masks, the transmission rate in a hair salon, for instance, we've seen anecdotally that it doesn't spread when people are wearing masks. So I was actually more concerned about yellow in many ways, because that was when most of the businesses were reopening. And I feel like if people continue to do what they've been doing, we'll continue what we've been doing here at the health department. And I feel like we can avoid any spikes from green.
Thanks.
In green, do you have any concerns that as people let their guard down, that mask compliance in particular could decrease?
Yeah, I think there's always a little bit of that. Look, we're all human. We feel like, green is go, right? And I think we have to keep pushing the message that green is go, but it's also being careful. And I think that most people are going to do the right thing, and that's what we need. What we can't go back to is back in February when nobody was doing anything differently. And I think if enough people sort of do the right thing, we're still going to have some cases, right? That's why we still have 15, 20 cases, whatever it is. And we're still going to work hard on doing those. And if we have a situation where there's an outbreak, we'll jump on that right away. But again, if most people do what they're supposed to do, and I want to emphasize, like I said, there's rules in bars and restaurants. If you're going out to a bar, really try to be careful when you go out there. These are specific things that we know from earlier on back in March, that we want to focus on certain types of businesses and bars. And anytime you mix alcohol with social distancing and sharing glasses and all kinds of things, people start to forget a little bit. And I'm not saying people shouldn't go out and enjoy themselves. We want people to do that. But there's certain things where we just want people to keep extra focus on when they go out in green, when things start next week.
Okay, and a question about contact tracing. In the region, Bucks County has been a leader in contact tracing, tracking at least 95% of cases. When the county moves to green, will the contact tracing staff be able to continue to track 95% of cases? How many cases can they realistically contact trace at one time?
Well, we had as many as 160 cases a day at the peak. And we never, we've been using some of our terrific, so we have some medical reserve corps people that have helped us out over time. Right now, again, the contact tracing, we're down to many fewer cases. So it's not as bad as it was. When we had 150, the only, thing that made it a little bit easier at that point was, number one, some of the cases were in nursing home residents. They weren't going anywhere. And the cases, and a lot of people were people that didn't really leave their homes. So the contact tracing at the peak of things was not as bad as it would be now. If we had 150 cases right now of people that were going everywhere, that would be more difficult. And we do have some people from the Medical Reserve Corps, as well as our own staff, some of whom are even moving back to their normal jobs now because we've gotten really good at it. But we have 8 or 10 people at least that we can bring in from a Medical Reserve Corps staff if we need to. But so far, we feel comfortable with the staff that we have been using all along. And again, the numbers being lower certainly makes it more doable.
Okay, here's a question I don't think any of you have heard before. What liability might Bucks County businesses have if a customer gets the coronavirus and it is traced back to their establishment? As most businesses look to reopen soon, how concerned should they be from a legal perspective?
Well, Tom's the only lawyer here, but he's from the transition team, so I don't know that it's fair for us to ask him to weigh in on that. I don't know if my colleagues have an opinion, but I'm really not sure on that.
Well, I would think in general, I think any kind of liability goes back to, is the business owner taking the steps that they should be taking or know they should be taking to protect whatever customer's coming into their facility. It's, if you have a sidewalk issue outside your business, it's a tripping hazard and you don't act on it, and someone trips and gets hurt, well, then obviously you're liable. If there's something you didn't know was a problem and someone, gets injured, then there's less liability. So I think for businesses, if they're following and they can show that they followed the guidelines that are put out by Dr. Damsker and our health department, state, federal, CDC, if you're following all of those steps, it's impossible, and Dr. Damsker said this, until there's a vaccine, it's impossible to stop the spread of this virus. You can mitigate it, you can slow it down. And so I think if you are a business and your employees are following the guidelines and you're following the guidelines and you're cleaning high touch surfaces and you're requiring masks to be worn, I think the liability keeps going down the more of those things that you do.
And if I could just chime in there from being a small business owner before I became an elected official, the one thing with my biggest worry was about liability. And just using a little bit of common sense here for our businesses. Again, follow the guidelines and whatever restrictions there are, and use a little bit of common sense. Just pick up the phone and give your insurance agent or your insurance carrier a phone call and just ask the question to them and make sure that you're covered and make sure you have the coverage. And I think that's pretty simple and common sense. Give your insurance agent a call and make sure that you're covered.
I think those were three very good answers. Partly, we don't really know. Partly, you want to be prepared and take measures against any risks. And Commissioner DiGirolamo's point, most important, talk to your insurance company about what they see as things you should be doing, or what the policy limits may be, or how that policy is going to be different because now we have, COVID-19 to deal with.
And I would argue also, and thank you, those are all great answers. And I would just mention from a public health perspective, as a business owner, you have no control over who comes into your facility. If someone has coronavirus, if someone has the flu, if they have pertussis, if they have measles, you can't control what they have coming into your facility. What you can control, as everyone has said before me, is how you're following the guidelines and doing your best to mitigate the spread of communicable disease. And I think just like at our jail, if someone gets arrested and has COVID and comes into the jail, we have a place, we put the person in medical isolation. But again, we have no control over who comes into the jail any more than a business owner has any control over who comes into their store. So I think that everyone's answers were really good. Do your best to mitigate the circumstances, and I think things will play themselves out.
Okay, question from Frida Savannah of the Bucks County Herald. Will county offices be closed tomorrow in observance of Juneteenth?
No, we're not closed tomorrow. I know that we have a number of bargaining units. More than half our staff are in bargaining units, and that is something that we're certainly willing to talk about, but we'll have to do that this year because we're in the middle of contract negotiations. Bob?
And also from Frida Savannah, are there any concrete plans to address the ongoing budget shortfall, and will any care funds be used?
I'm not so sure that there is a budget shortfall, so I'm not sure that that's exactly happening. We have a long-term structural deficit we're going to have to take a look at by the end of the year. But if you're referring specifically to expenses from the coronavirus, we will be using the funds that we receive through CARES to take care of them. Commissioner Harvey, anything?
Yeah, CARES money specifically cannot be used to plug any kind of loss of revenue from taxes or budget holes on things not COVID related. As Commissioner Marseglia said, we've been documenting right from I think it was really starting in February. We started documenting any kind of expenses we had throughout the county with regard to COVID-19. And that's been ongoing, and all those costs are going to be factored into how we use our CARES money, and CARES will cover those costs. In terms of moving forward, we've asked all our departments to take a look, and agencies to take a look at ways they may be able to trim here, trim there. One of the things we did as the three commissioners combined, working with our finance department, our chief financial officer, Dave Boscola, was we did take advantage of what was happening in the bond market to refinance bonds, and just learned a week ago that we saved to around $2.75 million. And so that's obviously, news that we did not expect to happen. And so that's, a positive for our budget outlook.
Okay,
Yeah,
well, that's the end
just,
of,
and again, as Commissioner Marseglia said, I'm not sure we have a budget shortfall. And I'm going to go back to our AAA bond rating from Standard and Moody's that, they did an analysis of our budget and thought we were in pretty good shape. And as Commissioner Harvey said, we cannot use the CARES money. That's the federal money that we have gotten to fill in a budget shortfall. But what we have been very, very prudent about is that make sure that any of the expenses or impacts from the coronavirus, that we do use that CARES money to fill in those holes and those impacts. So while we can't use it for budget items, that the CARES money from the federal government is going to help us, I think, a long way, because we do have impacts from the coronavirus financially, and we're going to be able to use that money to fill in those holes. So I am, again, optimistic that when at the end of the year that we will still be in pretty good shape financially here in Bucks County.
and that's the end of the questions that I've received. If any of you have any closing statements you'd like to make.
Just, we're grateful that you have walked through red and yellow with us, and we'll be excited next week to go to green. Thinking about the gym and my hair and the dog getting groomed all on the same day. Commissioner Harvey, any last comments?
Well, yeah, I'm kind of grateful to my daughter for the haircut she gave me over the weekend. She did a pretty good job. I made sure she practiced on her brother first, so that I'm not stupid. She did a nice job on him, so she got to move up to the major leagues and work on me. But yeah, really the people of Bucks County, overall have really been incredibly cooperative and steadfast in how they've approached everything that's been happening over the past several months. And I'm confident that we'll be hearing good news tomorrow. We're starting here to prepare. In fact, I have a meeting in about a half hour to start preparing how we can start getting guidelines together for green, so that we can post that as fast as possible on our website for businesses and people that want to know what the differences are and what things they have to do and things they should be looking for. So thanks again to Tom Jennings and the transition team, all the volunteers for the work they put in that's going to help guide us through the next several years and maybe beyond in terms of where we're going with the county to make sure that we're serving the people as best we can.
You're welcome.
Yeah, and I'll just finish up, and I'm going to show you, thanks to my wife, Donna, for my haircut yesterday. Actually, she's done a pretty good job. She never cut hair before, but she went out and bought a little razor and has been cutting my hair through this. So I want to thank my wife. And I just want to close. And again, I know Gail Humphrey from our election touched on it. I mean, we have an election task force that's going to have our first meeting here in Bucks County. And we're going to try to come up with recommendations how we can help our boards of election, not only here in Bucks, but around the state, how we can make it easier, especially when it comes to counting these mail-in ballots and absentees. And I think the legislature in Pennsylvania and the governor is going to have to make a decision that if they want results from the counties, and especially the larger counties like Bucks and Philadelphia and Delaware and Montgomery and Chester here in the Southeast, that if they want election results on election night, that they're going to have to change these guidelines and laws statewide to allow our Board of Elections to open up the envelopes before Election Day at some point in time, and maybe even start counting the ballots through the scanners before Election Day. So the legislature and the governor are going to have to make a decision if that's what they want to happen, that they're going to have to change these state laws. And I know there's been some talk up Harrisburg about possibly coming back the legislature sometime at the end of July or the beginning of August, because they're going to need 90 days to change these laws before Election Day if they're going to do it, and come back and maybe change some of these state laws and dates to make it easier for our Board of Elections to count these ballots. And I think that's going to be really, really important for them to consider because this is an important election, a presidential year, and a lot of people are going to come out and vote, and we want to make absolutely sure that everybody that wants to vote can vote, and everybody who does vote, that their vote is counted. So thank you all for being with us, and I'll turn it back over to Diane.
And that's it. Thank you all for being here. Thank you, Tom Jennings. Thank you, Dr. Damsker. Thank you, Larry. Thanks, Eric. And everybody have a terrific day and a great last week of yellow.